Again, I'm Daphne Robinson. I'm the chair of the Penn Center for AIDS Research Community Advisory Board. And this morning we have with us Robert Bruce Hill. He's the president of Road Chapter of Alpha Phi Alpha Fraternity Incorporated, and Tiffany Dominic, who is a grassroots advocate here in Philadelphia. We want to talk to you about being counted, HIV surveillance, the census, and voting. And one of the things we want to talk about is we're going to give you straight facts in the presentation that we give you. It's going to be factual information. But what we want to hear from you in the chat box and in the question and answers is some of your experiences and also answers to some of the questions that we've given you. We have known over time that different community perspectives have either not been listened to or not heard, and we want to make sure that we give you a space, especially to have a voice and be as interactive as possible, since we know that any other time we would be in front of each other. And we want to make sure that this virtual format is something where you can be as interactive as possible. So let's get started. The presentation overview, what we want to talk about is what is the importance of HIV surveillance? What is the need for the census? Why does voting matter? How are all three of these topics connected? And what is COVID-19's impact on everything that we're seeing as far as the surveillance, census, and voting? We do have a disclaimer. Of course, views expressed in the presentation will not only be factual information for you all to learn, but it's also going to be include some personal views and experiences from our presenters in what they've seen in working in various settings, in community, and that sort of thing. And we also want to say to you that we want to hear your experiences as well. Here's some background. And these are the questions we're going to give you a little time to put into the chat box. Do you know what the census is? Do you think that voting matters? How can HIV surveillance affect you and your community? And also, how do you think that the census, voting, and surveillance is interconnected? We're going to give you a couple minutes to reply in the chat box. So I'm going to leave the questions up for you and have at it.
Hey, Dacre, do you mind going back just one slide so that they can see the questions?
Oh, you know what? I didn't realize I hit that. Sorry. Thank you.
Oh, just for everyone, chat is disabled, but you're going to put your answers in the Q&A box. I'm sorry if that was, I didn't make that clear before.
So we'll start with the very first question on the screen. Do you know what the census is? This is really a yes, no kind of answer, but if you have an answer that's more descriptive, by all means, put that in the chat box as well.
Again, we want to get as much information from you as possible because we want to hear your experiences as well.
So I'm loving the responses so far. You guys are really being active. The responses are yes. These tools are important because we need to know the community size, needs, and priorities. Yes, I know what the census is. Yes, I think voting matters. Yes, voting does matter. They are all interconnected because the census helps determine voting districts, but it also freely gives the government your information. Yes, it measures demographics of a population, but any health surveillance comes with big privacy risks. Voting is extremely important. Yes, I know what the census is, and voting does matter.
Anybody else want to put anything else in the Q&A box so we can go on to the next section?
The census determines the amount of money the city will get from the feds. Voting matters is dependent upon which state you live in. Yeah, so those, that seems to be all of the questions that in response to what we put up, Dacre.
Thank you
Oh,
so
wait, there's one more. The census is a way to count all the members, including kids, and all living in the house to determine the services needed. It is important every 10 years. It is very important and safe to answer. Voting matters immensely. With our current system, it is the best way to have your voice and opinion included within the political decisions. So those were
Thank
all
you
of the
all for
responses.
taking the time to answer those questions for us. We just wanted to give you a way to express yourself. So right now we're going to watch a quick video on census.
I don't hear the audio, Dacre.
Can you hear it now?
No.
Okay, since you all can't hear the audio, let me see something. Hold on for a second. Can anybody hear it now?
It's low, but you can hear it.
Okay. At this time, we're going to turn it over to Mr. Robert Bruce Hill, who's going to give us some information about the census, some of the key terms, and then his experiences in working with it.
Thank you, Dacre, for that. And thank you to all of the attendees for your responses in the chat. As we know, in 2020, the census is very important, especially to communities that are likely to go uncounted. The census is taken every 10 years, and is mandated by Congress that that each community has like a population head count, and that is done to make sure that they have an accurate account as to who lives in these various communities. And again, it is mandated by our U.S. Constitution that it happens. And so once the census is completed, the U.S. Census Bureau must deliver a report of the population counts to the President of the United States. Now, we all know that COVID-19 has changed a lot of things that's been going on with the census, just due that enumerators weren't able to come out to houses, but then also a lot of individuals don't necessarily respond to documents that are sent to their homes because, let's be honest about it, a lot of individuals just don't trust the government. But I am here to tell you that the census is something, it is very, very safe and it's secure, but it's also very necessary that we do it because this is how the government tracks data, and even your family members who will be trying to look at where we all once existed in the next 100 years, and they go back and refer to the census data. I always like to use this reference. When I want to go back and find my family members who were here 100 years prior, the first thing you do when you do a Google search is they always say according to whatever year's census. So the census is something that's very important. And I just want to run just through a couple of things with you. I know some of the things that were put in the chat. But so the census data is used to conduct redistricting at the federal, state, and local levels. But then it's also a tool used to appropriate seats in the U.S. House of Representatives. So it's very important. Just here in the Philadelphia area, we did lose a congressional seat because of the data that we received from the 2010 census. So it's important that we count, because if we don't have anyone who's representing us at the federal, local, and state levels, we as a community can miss out on a lot. But then there's also, it's used to determine how 675 billion federal dollars are distributed to the various state and local governments. But then also it provides statistical support for grant applications. So for the programs that we do here in Philadelphia, or that Penn does, though when Penn wants to go to submit a grant for some programming that they would like to do, the granting officials actually go back and look at the data that was submitted to the census, and they say, hey, well, is there a need for this type of program here in the Philadelphia area, or whatever area that you're in, based on the data that was collected from the census. So just some of the things that your responses determine. So if you want to look at Section 8 housing assistance programs, responses to the census plays a huge part in that. Head Start to pre-K, small business development centers, state and wildlife grants, Medicaid and Medicare, emergency services and funding for hospitals and firefighters, and libraries are just some of the things that what they use the census data to fund. So who uses our data? Grant writers, businesses, policymakers, and a local, federal, state government, students and teachers, researchers, and the media. So it's very important to make sure that every household is accurately counted here in the Philadelphia area, or wherever you might be from. And I think it's something to, that I like to make note of. Philadelphia is what you call a hard to count area, meaning Philadelphia is a city where it's more than a higher number of its residents are likely to go uncounted in the 2020 census, and specifically in this year. Although that notion was out there, however, COVID-19 did play a huge role in that. So it's incumbent upon all of us who have this information to make sure that our family, friends, and neighbors know that the census is something that is very secure, and that we complete it, because we risk losing $2,100 per person each year if that person is not accurately counted in the 2020 census. So take yourself for an example. You represent $21,000 that we can get or we can lose if we are not counted in the 2020 census. So I'll turn it back over to Dacre, and we'll talk more about the census as we move through the presentation.
Bruce, before you go, I just have a couple of questions. Like, I'm concerned that people are not going to take the census, or that it's too late, because wasn't I supposed to respond by June 1st or whatever that date was? April 15th. And now we're talking June 26th. Isn't it too late for me to respond?
So no, it is not too late to respond. And so currently there has been, Congress is currently considering pushing the census data collection dates back. And from what's been, rumblings in the air is they'll be collecting data through October. And that is due to COVID-19, because when the questionnaires were originally sent out on March 15th, and then the first response dates were about March 30th, but we do know everything went into lockdown. And the Census Bureau also went into lockdown as well too. So the enumerators weren't able to go out to houses and to knock on the doors of the individuals who did not respond to the census. So the Census Bureau is now remobilizing and will be hiring enumerators. So just want to do a quick plug there. The Census Bureau is hiring for enumerators for those individuals. They'll go and knock on the doors of households that have not completed the census. So if you're interested in applying for a job, go to census.gov. But no, so the census, they did push the dates back, and it is not too late to respond to the census. So if you know anyone who has not responded to the census, please do so today, because it's important that we are counted.
There was a question in the chat box that says, can you complete the census online?
Yes, you can complete the census online. So there are 3 methods that you can complete the census. So you can complete the paper form that was mailed to you. You can complete it online, and you can also call the Census Bureau directly to complete the census. And if you did not receive a questionnaire in the mail, reach out to the Census Bureau. I can provide that information to you in the chat box, and reach out to them, and they can get you squared away with the completion of the 2020 census.
So Sarah also has a question in the chat box that I'm not going to ask you because I think you're going to talk about it a little bit later in the presentation. So we do see your question, Sarah, but you mentioned that Philadelphia lost seats last time in 2010. Now, thinking about this 2020 census, there was a lot of data and questions in 2019 about citizenship issues and having that as a question on the census. And so when we're thinking about the fact that we lost seats last time and there weren't as many responses, and then you have coupled with people's fears around citizenship, people's fears around just distrust of the government, what are the things that are happening locally to try and ensure that people, especially in light of COVID, that people do answer the census so that we don't lose any more seats?
So one of the things that the Census Bureau has done a very good job at is now in 2010, the Census Bureau was not online. You didn't have all of these different avenues where you can complete the census. There was also no social media advocacy as you see now. But what the Census Bureau has also done is worked with local community organizations to help get the word out about the census, but then also to build the trust. There's the motto out there that is the trusted messenger delivering the trusted message. So individuals such as myself, who represents an organization of Alpha Phi Alpha Fraternity Incorporated, we work with the Census Bureau in educating various communities throughout Philadelphia about the importance of the census, but then also ensuring that this data is very, very secure. The Census Bureau individuals, they do take an oath of office where they are not allowed to share this information. There's also a clause that's out there where the data that we collect today won't be used until years later, like down the line. That is something like that is law. So by the time the census data that is released, that is collected today, none of us won't be here. And that is just, obviously, to protect, like the census data, that is collected. And there's a good question about I know last year about the citizenship question, and there was a lot of fear of a lot of individuals because we do have a lot of illegal immigrants here in the United States. I'm proud to say that question is not on the 2020 census. Our legislators, they fought to make sure that it was not on there. And so the census will not ask you anything like too personal. They just want to make sure that they have the correct data of the individuals that occupy the various communities. So for instance, they just want to know like who might be living in your home. Is it at a house or is it an apartment? Is it owner rented? The sex, the age, and the date of birth of each person, the racial makeup of people living in a home, your ethnic identity. Are you people of Hispanic or Latino origin? The relationship with the individuals who live with you, whether that person lives or stays somewhere else, and any additional people who might be living or staying at the home, or your telephone number. Those are the basis of the questions that the census will ask. And so, with that fear that was once there around the citizenship question, that question is no longer there.
There was another question about, is the census multilingual?
Yes, it is.
And Bruce, there's also a question regarding how are the homeless counted?
So that's a very good question. And we all know Philadelphia has a high population of homeless individuals. There is a specific task force within the U.S. Census Bureau that is dedicated to going around to the various homeless shelters within a city, as well as going out onto the street to the various different areas where the homeless population, where they are. And those individuals are counted by that specific task force.
And also they do work with the Office of Homeless Services and the Office of Housing here in Philadelphia. So that we do know is a true thing that happens in the city to make sure that everybody's counted. And they will go anywhere that's necessary. So if you know that there is an encampment somewhere, they will go there. If you know if there are people under the bridges, they will go there. So again, it's about making sure that everybody is heard and everybody's counted.
Yep, absolutely. And Dacre, just to add to that point there, the Census Bureau has again reached out to a number of different organizations because the Census Bureau only knows what they know. And that's why you have the different organizations that they've reached out to help get on board, because there might be populations out there that they might not be aware of. However, or they might not be able to reach them. Let's look at social media for an example. There might be a population that might not be on social media. So how do you reach out to them? Well, they now have phone banks that they're doing to reach out to people. So it's just a number of different methods that the Census Bureau has employed to increase the numbers of individuals, that need to be counted in the 2020 census.
There's another question also, Bruce, and you may or may not know the answer to this, but we're going to put it out there. It says the census did not address non-binary people. Will future census include those folks?
That is a very good question. And I do not have the answer to that. But if you want to put that question in the chat, what I like to do is I always, questions that I get when I am giving presentations, I will then forward that out to the Census Bureau, for an answer, and then we can get back to you on that. But that's a very good question.
And it says, Victoria, you would like to answer that live, did you say?
Oh, no, I'm sorry. As you were answering it, I just pressed that and then I say that it was responded to. It's just to keep the question and answer
Okay,
box
no
clear.
problem.
Yeah. Sorry about that.
So a follow-up to that question, Bruce, is when we're thinking about what questions can be added or how it could be more inclusive, are there any tips or things that you've been told from the Census Bureau that as Americans or just residents of the US, like what is the process for getting things included? And what is the process of making sure that things that may be discriminatory or problematic, like the citizenship question, don't get included?
I think, well, the first thing it goes back to is, relying on your elected officials. In the case of the census, it would be your United States senators and your U.S., Congress, Congress, men and women, to advocate for these things. And the more that they hear from their constituents, the better that they know, because of course, they're there to represent us. So there is something that is lacking, or something that we would like to see that is more representative of us as a people. They need to know about this. And while the questions of the census are completed now, and just in 10 short years, the 2030 census will be here. So I would say, if there are questions that we think that might be more representative or that we need to consider in the future, start lobbying with your Congress, your Congress men and women, to say, hey, I know the 2020 census is here. However, we might need to consider these questions. And while the question might not be specifically like what you want, there are ways that they have in terms of phrasing the questions on the 2020 census. I go back to, now I believe, in the past where they kind of expanded, like your ethnicities, where that wasn't there on the 2010 census. So as we know, 2010 to 2020, a lot has changed in terms of how individuals are identifying. And so I don't see, I actually see that, possibly being a change to the 2030 census, because we all have, different identities, and we want to make sure that we are properly represented and identified how we want to be identified.
There's another question for you, Bruce, can you provide the phone bank locations? Are they here in Philadelphia or are they like nationwide?
So the phone banks are happening. So here in the city of Philadelphia, Mayor Jim Kenney has formed what they call a complete count committee. Complete count committees are established all throughout the entire country. So you have complete count committees from the state level, and then you also have it on the city level. And the city level is what you call Philly Counts. And Philly Counts is the complete count committee. And you can go to phillycounts.com, and where they do phone banks every day of the week. And they have a goal to call 1,000 individuals per day. I'm happy to say that they have actually been exceeding that goal every day. I've also been a part of the phone banking, and it works. I was a part of the phone bank that they did within the 19121 zip code. And within the 2 weeks of doing the phone banking in that zip code, census rates actually spiked up 3%. Now, while you say that might not be a big number, however, when you look at the 19121 zip code in its totality, that is a big number. So phone banking does help. It does work. And they, based on the needs of what we call the census tracts. And the census tracts is what the census uses as real-time data to determine who has responded to the census within a specific area. So I'll tell you, this is how detailed the census data is. I can go and pull up data block by block within the city of Philadelphia, and I can tell you exactly what households have responded to the census. And that is how we are able to determine which areas to focus on, what Philly Counts is to focus on, of the areas that we might need to reach out to help increase the response rates in that specific area.
Another question for you is there a way to obtain census information before the years that the census is protected for release?
Dacre, could you repeat that question one more time? I just want to make sure that I understand that question.
It says, is there a way to obtain census information before the years that the census is protected for release? So I guess they're trying to ask, is there, you know how you said that some of the data is protected for so many years and then it's released in certain ways. So they want to know, can you get information on that data before it is actually released?
No. And the reason for that is because, it is protected. So no data will be released, like outside of the time frames.
Okay. And the final question I have in the chat box for you is, can a person add non-binary in the other category if it does exist on the form? If there's a other category under gender or sex or whatever, can they add non-binary in that category?
I don't know, and I don't want to give a wrong answer to that. But what I would recommend to get that question answered is to call the Census Bureau, and they can give you a better answer or more of a direct answer in real time. And I can give that number out right now, Dacre, if you'd like.
Yeah, go ahead.
All right. So the number to call the Census Bureau is 844-330-2020. Again, 844-330-2020. I also encourage you to go visit the Census's website, which is 2020census.gov. There is a plethora of tools that are out there, as well as information, to educate yourself about the census.
Bruce, thanks so much. We're going to move on to something more, and then, we will continue to have more discussion and integrate census again later on in our discussion when we are ready to. So let me ask a question to the folks, and you all can just say yes or no. You don't really have to put it in the question and answer box. Yes or no, a form of the census has been around since biblical times? And the answer to that is yes. And also, we talked about it, the census includes people who are homeless or unsheltered, because a lot of times people don't think about the fact that homeless people are counted. They just think that there are a whole population that's missed. So the simple fact that people are really out there trying to count every single person is noteworthy. Okay.
I just want to quickly say that, when we talk about the census being around since biblical times, it was probably mentioned upwards of 27 times if you look at biblical texts about the census. And even in those references, it is also not unlike today. They were people who had trouble with the census in terms of the level of distrust and that. So I think some of our own concerns about governmental oversight and whether or not I should trust census and the idea of tracking in that way has been in existence for a long time. And so as some people's concerns about what happens with that information and how it's being used.
Thanks for that, Tiffany. Okay, hold on for a second. I'm trying to get the help. This is new technology for me, so thanks. We're going to move on to HIV surveillance. And of course, the surveillance is the nation's ability to track the HIV/AIDS epidemic throughout the country by gathering data through demographic characteristics, living status, mode of exposure to HIV, case definition. And a lot of times what we're hearing from people, when you hear the word surveillance, people are like, oh my God, am I being watched? What's going on? And people don't trust. Again, we're talking about oversight. People don't necessarily trust surveillance in the broader sense, especially with HIV surveillance. And a lot of the populations that are covered and the methodology is that all 50 states, the District of Columbia, US dependencies and possessions, and independent nations in free association with the United States report HIV/AIDS data to the Centers for Disease Control. And again, people are very, very untrustworthy of their data being taken and possibly breached. People think that their information will be breached if they give information about HIV/AIDS status. There's also talk now among small circles of people that people are going to be not really answering the questions, have you been infected with COVID-19? Because they're thinking there's going to be a stigma associated or attached with that. So again, we're just here to give you the facts and the information and also to hear your experiences around these issues. And HIV/AIDS surveillance activities are employed by most reporting areas, including 4 major reporting sources: your hospitals, your physicians, public and private clinics, medical record systems, death certificates, tumor registries. Using a standard confidential case report, the health departments collect information and transmit it to the CDC electronically. Hence, you have more electronic medical records without personal identifiers. These estimated data on HIV infection and AIDS are adjusted using a maximum likelihood statistical procedure that accounts for the differences in reporting delays among various characteristics. And surveillance data is provisional and updated annually. Now, in saying that, we also have to be mindful of the fact that different hospitals, clinics, agencies have different electronic systems. Sometimes they get the data on time, sometimes they don't get the data on time. Sometimes when you look at statistics around HIV/AIDS, cancer, and other diseases, you may have a report that says 2018, 2019, and you want to know what's happening in 2020. Sometimes you have to wait for that data to be collected from various parts of the country, all the 50 states, Puerto Rico, US Virgin Islands, those folks, they give that information and it has to be read, processed, and then after that, you can get a report. So again, it takes time for those things to happen. And I know that people are very, very reluctant in trying to give that type of information and feeling that their information is going to be taken and used and expose their name as well as their location and where they live. We have anything in the chat box?
There was something in the chat box from Keith. He was asking, is a person's name reported to the health department upon a positive test result?
Upon a positive test result, their name is reported, but once the health department has it, it is protected and it is confidential. So no one gets that information at all because they have to do names reporting. They have to do that. Now, Philadelphia, when names reported started several years ago, Philadelphia was one of the last holdouts of not wanting names reporting to start because they truly believe in listening to the advocacy in the streets that people thought that their names would be used against them because people have been discriminated against over the years when it was found out that they were HIV positive. And this is a very quick video on HIV surveillance. as you can see with from AIDS View, this is local data here in Philadelphia from 2018, where they had approximately 18,380 people living with HIV in Philadelphia. And of those, 427 were newly diagnosed with HIV. Now, if you look at the map of Philadelphia, this is where the surveillance comes in. You can see by the shades of the different populations, the different areas of the city where there might have been more infection or more people infected with HIV or living with HIV, and as opposed to others. So again, it comes down to trying to make sure that with the census data being collected, that the money that we get for programming can make sure that people have care in some of the areas that are the worst hit. Now, it's the same thing that's going on right now with COVID. You see, we're talking about African-American communities in Philadelphia being predisposed or, getting the COVID virus more because they don't have access. So again, census brings the money in, you are part of that, you are $21,000 worth of care, and that way it can help you out and help the community that we serve out every day.
So I do have some comments. So what Dacre has really been talking about in terms of this HIV surveillance is about getting tested and then that information being reported. But there are multiple sources of HIV surveillance that happens within Philadelphia, but also nationwide and the world. And so the surveillance is about HIV testing and reporting. And it's just generic, anybody who gets tested, whether it's at a doctor's office, at a clinic's office. But then there are targeted surveillance activities that happen that specifically target populations to see, is there a higher increase in HIV and trans women, or in injection drug using populations, or men who have sex with men. And so those things happen on a cycle basis. And it's really, in that regard, it could be people who are known positives that are going to get tested to give us a better sense of what the population specific risks are. Additionally, when we're talking about surveillance, one of the things that happens is that someone tests positive for the first time, and we try to ascertain where did they come in contact with HIV. So what ends up happening is a person gets tested, we ask them a series of questions, and or they get referred to disease intervention specialists, which in Philadelphia comes out of Health District number 1, who in many ways, we're learning this word contact tracing as it relates to COVID, but in many ways that was something that had already existed in HIV, where they then try to find out where the risk came from. So surveillance happens in that way. And then they also have something called molecular surveillance that happens. And that is in relation to trying to find out what type of virus is going back and forth between people and potentially finding the source in that way. So from a molecular virus standpoint and not from an individual standpoint. So there are lots of HIV surveillance that is happening. And I wanted to say that because I see that Jill asked the question about, as with COVID-19, contact tracing is emphasized. The information in China narrowed down to a specific area of concentration of the virus, and subsequent action was taken. There is a lag in HIV surveillance information. So how can prevention efforts effectively target those populations of areas? So my response to that would be similar to Bruce's response when he talked about that they can look at information and see, oh, on this block, these people did not respond to the test. The health department does have a way of tracking disease. And so what they will say, you can look at, they put out mapping and surveillance data probably on a quarterly to biannual basis. So in that information, you start to see shadings of a zip code. They don't necessarily give you as small a detail as census tract data, because HIV is still a very sensitive issue, and they don't want to make it so identifiable in locations that you could literally pick out the person. But they will give you enough information to say you need to target your HIV prevention work in this area or this zip code. And they do that by looking at HIV data, but also by looking at STI data, in terms of helping programming determine where is the best place to put efforts.
And Keith has a question also. Are we referring to clustering or seeing a spike in a particular area when it comes to
all of the above? The clustering and spiking typically is done through molecular HIV surveillance, where they're trying to figure out where spikes happen. Other HIV surveillance that most of us are more familiar with really is about trying to identify a hard number, not unlike the census trying to identify a hard number, but also trying to figure out where best to put money and prevention efforts. So not only the total number, but to say, oh, we see an increase in this total population, not this population in this neighborhood. You can do it that way, but oftentimes how the messaging happens is about where the increases are across the board.
And one of the reasons is that we wanted to make sure that we give you all information such as this is because last year, being a part of the Center for AIDS Research Community Advisory Board at Penn, you get to travel around the country. And we have a national C4CAB coalition meeting every year. And we did a community symposium that last year at the University of North Carolina. What we found was during this community symposium, the health department came and did a presentation to community members on molecular surveillance, HIV surveillance. And a lot of the people were very, very upset because again, as the question earlier said, it's very, very tricky. Is personal information going to be put out there? A lot of people thought or had the idea that, can you identify me specifically? Did I give you permission to use this data in this manner? So it's very important for us when we work in these fields and also to be community voices, to let people know that your information is protected. We want to make sure that we get the services to the populations and the communities that need it the most. And that's a very important thing. Once the health department did, finish talking about molecular surveillance to the community members, and I have to say it was very, very heated discussion. And we had to say to the health department, you really handled it, because the community was really, really vocal about making sure their voices were heard and actually saying, you all need to put a moratorium on this and go back to the CDC and say, we're not going to do this. So again, your voice matters. The people we serve, their voices matter. They need to be heard.
So there is a question that says, zip codes are not given in suburban populations because of the possibility of identifying people. How have you seen that these areas are dealing with this? So I want to, in some ways, defer to Dacre about this because she worked in the counties for a very long time around HIV. But in general, my response is that what ends up happening is they just give you go to this population. We know that this population is at highest risk, or we know that this generic area, based off of crime rates, based off of poverty, based on off of all these other things, it then becomes, again, how you're looking at the census data and saying, okay, the census says that this is a high crime area, or that there is more poverty or more unemployment, or all of those things. And that is typically what people will try to do, and or look at STI information or other things to try to determine what is the best way to address prevention services in a community.
And Tiffany, you really hit on it, because in working in Montgomery County for 18 years, the bottom line is that Montgomery County is one of your most affluent counties in Pennsylvania. You only really have, if you really break Montgomery County down, about 50% of the county is rural. So you're talking farm areas. Then you have two urbanized areas of Norristown and Pottstown. And that's where you have pockets of poverty. So when it comes to, looking at zip codes, there are only really two areas where you may have extensive injection drug use, possibly. You have extreme poverty, you have lack of access, and those two populations. Now, don't get me wrong. We're not saying that people cannot be throughout Montgomery County living with HIV and AIDS, but those are the two sections of the county that you go to first. Just like some of the other suburban counties, whether it's Chester County, Delaware County. You look at Delaware County, you think Darby, you think Upper Darby, you think, pockets of poverty. You think Coatesville, you think, different sections like that. So when it comes to looking at HIV on a big spectrum, again, it is by target population. They look at the people who go to the regional clinics, and be mindful that they don't have in Montgomery County access like we do here in Philadelphia. And a lot of times we think about access as, access to doctor, access to education, whatever. We're talking in Montgomery County, access to SEPTA, access to getting on a bus. You know what I'm saying? So just something that simple can put somebody on a trajectory where they're not going to the doctor because they can't get there. So it's things like that we take a look at. And it's mainly not, as said, it's not based on the zip code, it's based on the borough or the township, pretty much.
There were two questions, and I want to, while I'm answering one, I want you, Dacre, to go back to the map of Philadelphia for the other. So the question that you're going back to that map for was, how do we identify our neighborhoods on the Philadelphia map? I'm not sure I can identify where I live on the map. And the question I'm going to answer while you pull that up is, how do we consent or not consent to the use of stored lab samples? So you don't consent to stored lab samples, or you're not, it is not a requirement for your consent. When you get tested and a confirmatory test is done, those results automatically get sent to the health department because HIV is a reportable disease. So you don't consent. Your consent was you took the test from that standpoint. In terms of the molecular surveillance, again, your consent is that you took the test. There is no verbal or written consent as it relates to that kind of use of your samples.
Exactly. And that's where people have a lot of angst over that. And Tiffany, you gave a great explanation of that, because people feel, again, did I give you consent to do this? Or, so it's just something that we want to make sure that people understand and that they're aware of, because again, these things help to bring care to communities that need it the most.
So when we were putting this presentation together, we did not think to add census tract maps the way we did for this HIV map, but I want you to look at the HIV map. And if we were to pull census data information, it would mirror in all likelihood how this map looks in terms of the darker shades. Mm-hmm. So this is going to be hard for me to explain because I'm visually impaired. But if you can see AIDS view, those words on that map, when you look at the U, there's like this little white line that's going down the side of the map. If you can see that, that is Broad Street. And so when you're looking at that, that is kind of your marker to help you know where the city is. That really dark maroon, deep red color that's all the way at the top to the right, that is the prisons. So that's basically State Road over there.
Yep.
Now, when you're looking at that white line where the end of that U is, and that's Broad Street. So on the left side, on the right side of that is going to be North Philly. When you get to that darker red right underneath the U, that's like Hunting Park area, right below where that black line is. Then you're going to get towards like Girard, moving towards Center City. When you go look at the left of that white line and go fairly far down, you're going to be looking at West Philly like that. So if that kind of helps you orient yourself to the map. And in typical fashion, I would say that HIV in Philadelphia looks like a J. The hardest hit areas are going down Broad Street, and it kind of makes that J shape. And it's going to go a little bit into South Philly and then loop back up into West Philly. So that is kind of where the disease is. And that same trajectory is where you will see higher crimes, higher poverty, less access. And when I say access, I do mean access to medical care and access to transportation, but I mean access from the standpoint of, I may have a job, I may have insurance, but if I take off from work in order to go to the doctor, I'm losing a day's pay and I can't afford to do that. So therefore I don't have access. So my definition of access is a little bit broader, just so you know that when you're thinking about it and you hear me say the word access.
Okay, thanks, Tiffany. Let's go, what's next? Now we're going to get into voting. You see on the left things that are happening now, and you see on the right things that are happening in the past in various communities. We know that there is a lot of people who don't want certain populations to vote, or certain people to vote, and we know it's a real thing. So here's the final video of the day. I'm sorry that the sound is so bad. I thought I was doing something when I was, this is my first time really doing videos in a PowerPoint presentation. And I thought I was doing something great, but apparently it didn't work so good, but please forgive me for that. But here we go.
Yeah, we can't hear this one at all, Dacre.
Really?
Hey, Dacre, would it be easier if you maybe stop sharing your screen and then actually go into YouTube to pull the video up?
Yeah, let me see if I can do that real quick, if it takes time. So in the meantime, while I'm trying to figure that out, so please continue to talk.
So one of the things that we wanted to talk about as it relates to why we picked all of these things to go together, the census, surveillance, and voting, is because as you heard us talk about the census data and what it collects and kind of how people use surveillance and census data and surveillance in order to do prevention activities and treatment activities around HIV, that same thing relates into voting. So the census determines how many seats you get. Voting determines who you put in as policymakers in order to help with the money that will give us access for prevention and treatment activities in HIV. That was my take on how these things are interrelated, but we would love to see you guys tell us why you think that they're interrelated.
Okay, I think I may have it, so let me, hold on for 1 second. Let me start it again, and I'm going to, hold on, first of all, I gotta pause it. Okay, let's pause it. And then I bring it up.
And then Dacre, make sure that you click share computer sound too once you bring the presentation back up.
Okay, let me see. Share screen. Okay, share that. And you said share computer sound, where would that be?
Yeah, so if you look at like the bottom.
I found it. Okay. Let's
right
go.
Right now you have it's on mute.
Watch the Super Bowl, then exercise their right to vote. We've got some serious issues to deal with. So how come so many of us don't even bother to vote? Is it because we don't care? Or maybe it's because we don't know our history. So let's go back, way back. Our country's first election came after fighting for our independence, a fight that cost many lives, but it was worth it because instead of being ruled by a king, we were finally able to make our own laws. But not everybody was allowed to participate. You see, back then, you had to own property, be white, and a man in order to actually vote. Now, things continued that way for about 80 years, until after the Civil War, when slavery was abolished and all men were given the right to vote.
Now hold up a minute. Just because we had the right to vote didn't mean we could use it. See, all these new voters wanted to participate, which threatened the people in power and their ability to stay in power. So they tried to stop us with violence and shady new requirements like literacy tests and poll taxes. We had to fight for nearly 100 years before the Voting Rights Act passed, which finally outlawed these dirty tricks.
And you weren't the only ones that had to fight for your right to vote. Somehow women got left out and had to organize and fight state by state, until we took our fight to Washington and finally got our right to vote all across the country. And even once the laws guaranteed every person the ability to vote, you still had to be 21 in most states. So when our government began drafting people under 21 to go fight in Vietnam, they realized their lives were at stake and they had no say. Young people all across the country rose up in protest and demanded that everyone over 18 should be allowed to vote.
And since then, young people's votes have been crucial in deciding lots of big elections. Like in 2008, when a black candidate had a real chance to become president, young people showed up in record numbers. And every year, we make up a larger share of the voting population, giving young people more power, but only if we participate.
So let me break it down. Together, there is so much we can decide, like whether or not we should go to war, or how we spend our money, and how we power our lives.
We can determine who has the right to marry and who has the right to choose, what possessions should be outlawed, and whether or not we should legalize.
It's up to you to make your choices and shape our future. If we sit on the sidelines, then others will make it work for them instead of us. So let's make our voices heard.
So what would it take for you to vote?
Okay, I have to stop screen. Okay. All right, let me go back to our, where am I?
You want to
Okay.
close that and then open up your presentation again, and then share that.
Okay, let me go back from.
While you're doing that, we have a comment that says most people do not vote in midterm elections, which directly impacts their daily lives. Voting in a presidential election is not one person, one vote. If you live in California or New York, your vote will mean more than someone in Vermont. The census, voting, and surveillance are the educational tools that all should be made aware of. Great webinar.
Well, we thank you for that, because what we're trying to do again is get that information out to folks and make sure that they understand what's going on. So Robert, Tiffany, we all can participate in this one. So just to give key terms real quick is, voting is the right to collectively choose a candidate for office in elections of several types with one vote per person who is legally registered. Then you have voter suppression, which is tactics of fear, intimidation, or law that prevent one group of people from having their voices heard and counted. So let's really get into that portion of voting and what's going on. We've heard and seen in the news of the civil unrest. You've also seen people who have gone to the ballot box wearing masks, having to stand 6 feet apart. And, then you hear the issues of mail-in ballots versus standing in line together with COVID-19. So let's talk about all of this.
So for me, I can tell you that mail-in ballots is the best thing that ever happened, as far as I'm concerned. Because as someone who is afraid of getting COVID, I don't even want to go into a voting booth and touch the screen. And I don't want to be waiting in line for 20 hours. But I recognize that there are some concerns even about the mail-in ballot, about getting it on time, about whether or not it's going to be counted. all of those things. And there's certainly, I had concerns about this mail-in ballot rollout this year. And there were certainly some issues with it. And even people who, because of COVID, the reduction of polling locations, and people being sent postcards. I was on a block where people were sent postcards for 2 different locations, and we all live on the same block. And any other time, we would be at the same polling location. And then they got to that location and were told, no, you had to go to the other one, and then had to wait in a line for 3 hours. And so COVID, in many ways, has changed how we are going to be voting in the future. And unfortunately, I believe that it does potentially leave seniors out when we think about how typically we have these campaigns that happen, especially around presidential elections, about giving seniors to the poll, rides to the polls and that kind of stuff. I didn't even think about leaving my house on election day. And then it wasn't until one of my neighbors is like, oh, I can't make it to the poll. It's too far for me to walk. That's when it occurred to me, we weren't even doing an active campaign to get people to the polls. And so that's certainly something that we're going to have to think about and still and manage people's risk as we relate to getting people to the polls. If we are in a second wave come November and we're going from 800 polling locations to 107.
We have, okay, somebody said, can we talk about what happened recently in Kentucky with shutting down several polling places and then locking the doors on hundreds of people waiting to vote? Is that legal?
So Dacre, I'll jump in here.
Yep.
Absolutely, that is not legal. And so when we talk about voting, everyone, having the access to vote, that is the prime example of what we call voter suppression. If you look at, Kentucky, I think they reduced their polling places, I want to say maybe by 95%. But in one of the largest counties with the largest cities within Kentucky, I believe there were maybe, I don't know the exact number of polling places, but it wasn't sufficient enough. And so that already posed a challenge there. And then it also, if you look at it, it excluded Black and brown individuals within that community. But then officials went and locked the doors. So that is something that should never happen. And I imagine that there will be some lawsuits coming, behind that with some soon to state, because you should never deny anyone the right to vote. Now, putting our political differences to the side, this is just the straight facts. This is just the straight up information. We have, our friends, within government, who support the policies of a rogue president, and that is just another way to promote, to keep them in office. We do know individuals are more engaged than they were, before, and it's because of the things that are happening, within this country, and that should never happen. And voter suppression has been occurring all across the entire country. It was the same thing that happened in Georgia. But Kentucky is our most recent, example, and that should never happen. Now, does that put fear in voters? Absolutely it does, because that is the clearest example of, my vote doesn't count because they don't even want to allow me to vote. But again, it's just the gross negligence and the willful negligence of those officials within Kentucky to try to prevent voters from voting, and exercising, their right.
And you also have to be mindful of the fact that the Voting Rights Act has been changed 52 times. There was a time during the last time the Voting Rights Act was touched, there was a requirement that Southern states had to let the Department of Justice know what type of rules or regulations they were going to put in place before they did anything around voting. Once that was gutted, they automatically put in place things like voter ID and redrawing lines, and as Bruce said, closing polling places. Like Kentucky said, they said because of COVID, but we know that's not true. So there have been several things over time that have been taken away from the Voting Rights Act, where we must get up again and make our voices heard, and so that we could fight for those things to come back. Somebody said, my mail-in ballot never came after mailing it in. My mail-in ballot never came after mailing it in. My notice came on the voting day after 3 p.m. I went early to vote. How can we advocate for improvement in the mail-in ballot process?
So there are a couple of things that I would say you can do as relates to that. We all have our own individual beliefs. I'm only going to tell you about nonpartisan organizations to join, but you can join Committee of 70 or League of Young Voters or League of Women Voters or NAACP or Urban League. They all have some voting component or civic engagement component in their organizations, where they work on policy initiatives that include early voting in states. And this is nationwide, but there is some activity to try and get early voting in Pennsylvania. So not just having that one day and mail-in ballots, but having 2 weeks worth of time where you could vote if you wanted to do it in person. But they're also working on the problems related to mail-in ballots, because I can tell you, before the mail-in ballots, that was passed, but there were also new voting machines that went out into different counties in Pennsylvania. And so there was a lot of concerns before COVID about how just the machines themselves were gonna work, because every single county did it differently and how they contacted to get voting machines. So there are some that have the potential to create the hanging Chad of 2000. And there are others who they give you a printout of what you, how you voted. Every single machine is different within the counties in Pennsylvania. There wasn't a consensus that we're all gonna use that. So there are a lot of activities and organizations you can join that are trying to address those kind of issues, because there's certainly post 2012, there certainly was more concern about, or the 2016 election, there certainly was more concern about voter fraud, voter suppression, and what kind of things are being put in place. So there are definitely organizations that are actively addressing those things. In terms of getting a mail-in ballot, you can go to votespa.com, VOTESPA.com, to request a mail-in ballot for the November election. There is a question on the questionnaire. I believe it's question number 7, that if you check yes to that, they will continually just mail you a ballot every single election. That is how it's supposed to work. Now, whether or not it does that, we'll yet to see. They may come up with something come next primary season about how they want to address mail-in ballots. There was a statement in this question about, could you also touch on the importance of midterm elections? Elections happen every 6 months. So not even every 2 years, but every 6 months, there is an election that is happening. And in Pennsylvania, you're voting for judges, you're voting for district attorney, you're voting for sheriffs, governors, mayors, city council people, reps, state, Senate, all of that. And then US federal seats. So and then there are always going to be ballot questions. So those are things that you have a voice that you could express your right every 6 months in Pennsylvania, not every 2 years, not every 4 years. You literally can say how you feel and elect people in power to address what you think is important. The other part of that question was around independent voters. Pennsylvania right now, in order to vote in primaries for candidates, you have to either be a registered Democrat or a registered Republican. In a primary, you can vote as an independent voter, you can vote on ballot questions, and that is it. Again, all of those agencies and organizations I mentioned earlier, they're all working on changing that as well, that independent voters can vote across, as well as registered Republicans, Democrats can vote across party lines, even in a primary. I don't know where that's going to go, but that is certainly some initiatives that are being worked on at the state level from all of these organizations.
And we also have a comment around COVID or no COVID. Many minorities showed up at the polling sites because they fear voter suppression in the mail-in ballots. And it was apparent even at the polling sites in Kentucky and other states' primary elections. And again, this is true. So again, as consumers, people who have voices, we have to make the choice what we're going to do in November. Are you going to mail in that ballot? Are you going to stand in line? It's really a personal choice. And it's something that you would have to really think about when that time comes. Right.
You know, we're talking about voting, and I certainly want to give Bruce an opportunity to weigh in on any of these topics, but I think it's important to know that civic engagement is more than just voting. It is those folks that are out on the streets right now protesting and calling for defunding of police and recognition that Black Lives Matter. It is voting at the polls. It is those PTA meetings that you go to and those community meetings about gentrification happening in your neighborhood. It is about the work that you're doing in the nonprofit sector. There are other ways that civic engagement happens, and I don't want you to lose sight that there are certainly ways that you can participate in the process in addition to voting.
Bruce?
Can you hear me?
Yeah, we can hear you.
So I think a lot of things about voting, and if there's two things in life that I'm passionate about, that is voting and the 2020 census, because they determine so much. But in terms of voting, right here in the state of Pennsylvania, I want you all, when you get an opportunity, is to go to the Pennsylvania NAACP State Conference's website. They have filed a lawsuit against the state of Pennsylvania around the voting law changes that occurred during this past election. And if you look at the big fiasco which occurred with the mail-in ballot procedures, a lot of individuals were left out, were voting. There was miscommunication information that was put out there. So they are suing the state to ensure that this doesn't happen again. Again, we don't know what's going to happen, with COVID. But we need to rely on our state officials. Urge our state officials, or not all of our elected officials, to advocate, for these rights. And again, if these elected officials are not advocating in the ways that we want them to, that's where the power of our vote comes in. Just not in a presidential year, but again, like these smaller elections. The local politics affects us more so on a day-to-day basis. And I want to drive that home because most of us don't show up for mayoral elections or when we have to elect judges, or even when we need to go and answer those city ballot questions. Those are very, very important. And it's up to us as the constituents of these different cities, to take an active stand against it. We elect individuals to advocate for us, but then we also have to advocate for ourselves and put the pressure, on them. With voting, it's, 2020 voting is just different. I've never seen anything like this. And I've been voting since I was 18 years old. Growing up, I knew that was something that you had to do. But it's the educational piece, right? We need to also educate individuals as to why it's important to vote and just not say, hey, that determines like the next president. Look at Medicare or look at, what's going on with the healthcare system. You have our elected officials who get to determine, what kind of like healthcare that the government provides. You have some that believe that the government shouldn't provide any healthcare assistance. You have some who believe that we should. I believe that the government should be funding healthcare, for everyone. But we have to have the right individuals in office to advocate for that. Or if you look at programs that directly affect us here on our day-to-day, those elected officials make those decisions, but we have to have those elected officials in office to make sure that they are advocating for the true needs of their community. Now, I am saying this on the record. I know some of my fellow friends of politics will probably disagree with me, but I am a whole fan of having term limits on all seats. If the president of the United States has a term limit, I believe that should go all the way from the federal level all the way down to the local level, because there's only so much that you can do, and we need fresh ideas and we need fresh perspectives. And when you are no longer in touch with what's going on and how things are operating in a current day, that is detrimental to the people. It's no longer about the good of the people, but it's more so about my individual, like wants and needs. And that's not what a democracy is. So, with voting, going back to it, when you want to talk about funding of programs and things that we need, these legislators go and they can say, hey, I want this for my constituents, or I don't want my constituents. We need to make sure that we have individuals that are in office that represent the will of the people and not the will of themselves.
There is another question in the chat box, but I wanted to go back to something. There was a question around what was happening in Kentucky, and you mentioned Georgia. Are there differences in the federal mandate for voting and state mandates? And that's why we see the variance and what happens in these elections?
Well, I think so. I mean, so when you have the variations would be, like everyone has like their different election dates, right? Mm-hmm. But the access to voting is your constitutional right? And the Constitution says, everyone has the right to vote. So states don't get to determine, like who gets to vote, or who doesn't vote. It's just the individuals who work behind the scenes to make sure that they do suppress individuals, from voting. And where is that all driven from? That's all driven from, our federal level. And we have individuals who are out there who are making these decisions. And the individuals who are not engaged are the ones who are left out, and the ones who are seriously engaged, those who have their personal agendas, are the ones who are making the decisions for us. I don't know. Did that answer your question there?
It did. I do want to say that states do determine who can vote, because from the standpoint of some states won't allow people with a felony conviction to ever vote, and some states will. So there is that is a state by state determination.
Yes, you know what, Tiffany, thanks for that correction there. So Pennsylvania is a state that does allow those with records to to vote. However, there is a lengthy process that you have to go through. And this was something that I just found out within the past couple of years, because that's just not something that that is widely discussed. So those who have records are able to vote. It's just a process that they have to go to, to get registered.
So there is a question in the chat box that says, is there any progress in efforts to make Election Day a legal holiday, and perhaps on a Saturday, so that it is easier for people to vote and to motivate more people to vote?
That I do not know. And that's a good question. I've always thought that, but I don't know. I don't have an answer to that. So
for me, my response to that is that for that designation, granted, we did see just last week, I think that was last week, that the state made a decision to make Juneteenth a holiday. So each state can make a decision to make an election day a holiday. And that has not happened, because I think at some level, there is more of a push to make it done at the federal level and not at the state level. But each state can determine when, as Bruce said, when their election days are. So they could put in place a process where there's early voting and on a state by state level, or that there is election days on Saturdays. So that is a possibility, because places like Wisconsin, you can register and vote on the same day. And that doesn't exist in Pennsylvania. Right. There, like in Texas, early voting happens for 3 weeks before the election, the final day that you can vote. So every state and their mandates for how they want to see elections set up could do that. And I say that to say that for those places where early voting happens, that means that you can go to a polling location on a Saturday or a Sunday to go vote.
There's another question saying, any chance of eliminating the Electoral College and move to one person, one vote? We hear people talk about that all the time, but we really don't know the answer to that, and we really don't know where that's going to go, because a lot of times people are like, the Electoral College also makes decisions that we don't necessarily make. So that's why some folks think that my vote doesn't count.
But I want to reiterate the point that Bruce has made and that some of you guys have made about voting beyond the presidential election in terms of midterms and local. The Electoral College only exists for the presidential election.
Mm-hmm.
Everything else, your vote, it really is one person, one vote, and there is no Electoral College to determine who the mayor is of your city, or the city council person, or the judge, or the governor, or your state and your state rep or senate. So there certainly we want to have a discussion about Electoral College and making changes to that, I think, but it is not the only way people see their representation happen in the political process.
We have 7 minutes left, so we want to get through the rest of the slides. We thank you all so much for all of these wonderful questions. So let's keep it 100. Again, we talked about the census bringing money for programming needed in poorer communities. Surveillance allows researchers the ability to find ways to target the HIV virus to make sure that care is received. And voting allows us the ability to put people in office that could help our causes. So we do know those things. It's just that we have to mobilize ourselves to get it done. We talked about how COVID-19 put a wrench in all of it. You have the mail-in ballots versus the social distancing at polling places, and which includes the voter suppression piece. Census workers cannot come to your home to make sure you fill out the census, which will be happening soon, but I guess it might be at a staggered pace. And HIV surveillance, when you think about it, the hospital focus now, or the research focus now, is on COVID-19. This is not to say that they're not still doing surveillance for HIV, but COVID has taken over everything. And we have a lot of medical offices that are closed and people can't get care until things start to open back up. So we were on total shutdown. So why advocate? It says, unless someone likes you, cares a whole awful lot, nothing is going to get better, it's not. And that's from Dr. Seuss's The Lorax. So you have a voice and need to be heard. We can make a change together. Your community needs you, and every little step helps, no matter how small. Let's see, I'm getting ready to the last slide. These are our sources for today. We thank you so much for being a part, and thank you so very much. If anybody else has any quick questions, we have 5 minutes left.
So there is a question about, will these slides be made available after this presentation? I don't know the answer to that. So Dacre or Kyle or
Kyle will have to tell us. I mean, 'cause they want them done
about that. But I wanted to, like Dacre, thank all you guys for participating, and I want to give a shout out to Cynthia Ducaret. I hope I'm pronouncing your name correctly, because I saw that you were the first person excited to be on this webinar today. So I want to thank you for starting us off on having such an active crowd to participate today.
And thanks everybody for being a part. Bruce, your final word.
Somebody said, go back to the last screen. I missed it. I think that was a resources page.
Okay.
And there was a, how can I get involved in the CFAR CAB if I'm interested?
What you can do is
go back to the last page. Yeah.
Okay. For Penn CFAR CAB, you can contact Amy Honorado. I will give you her email address.
Her office number is 215-746-7352.
You quick. And she is the CAB coordinator for us. So you can give her a call and then she would be able to give you more information. Any other questions?
No, thank you, everyone. Dacre, I just want to put just this one thing out there, just, for everyone. So voter turnout in the city of Philadelphia on the June 2nd election was 32%. That's just something to think about. Let's increase that for November.
Okay.
And Amy did put her email address into the chat box for people. It was aonorato@pennmedicine.upenn.edu. So definitely check out the chat if you want to join the CAB, Community Advisory Board.
Yes.
And real quick, before Vicky closes us out, I just wanted to let the audience know that the Community Health Training Alliance will act as a liaison for any resources. So thank you everyone for asking for resources, and thank you to the presenters for providing them. Any follow-up, we will happily be a liaison for that.
Okay, thanks so much for having us.
And thank you so much for everyone coming. I really enjoyed this webinar and really enjoyed the kind of interactive way that everyone was answering questions and asking questions. I feel like there were a lot of questions and concerns that I didn't realize I had until they came up, and they were really well addressed. Just kind of following up on what Kyle said, any resources or any questions that people have, they can reach out to us at the Community Health Training Alliance, and we'll connect you to the speakers. One other thing before we close, when you log out of this webinar, it's going to come to a page that has a survey. If you can take a few minutes to fill out the survey, it'd be super helpful for us. This is our first year doing the Prevention Summit online. So getting any type of information on what worked and what didn't work would be super, super helpful. And thank you so much for bearing with us through all the technology. We got the videos to work, and thank you to the speakers for figuring that out, because that was, we really enjoyed this. Any other closing statements before we end from the speakers?
Nope, just thanks again, and we hope that we were able to give you information that you can use and to take back to the communities that you serve.
Register to vote and encourage somebody to register to vote.
Yes, and encourage everyone to complete the 2020 census.
Thank you so much, everyone, and have a great day.
Thank you.
Thank you. Bye.